My name's Teresa Waite. I was in ICU, I think the end of March, beginning of April. I can't remember how long for. I would like to say a big thank you to all in the ICU. You do a fantastic job, and for what you did for me to see my grandkids again, I really do appreciate that. Hang in there. I know it's tough. You will get through it, and everybody do appreciate what you're doing, and we think about you all the time. Thank you.
My name's Stacey. I'm Teresa's daughter, and my mum was in ICU. I think the main thing, to be honest, is that sometimes if it feels like you're not helping or you're not doing enough, you definitely are. But I was being told that she probably wasn't going to make it. I had to get her will and everything ready because I was told she wasn't going to. I had to try and run her business. And because of all the work that everyone in the hospital did, my mum came out. And she's not 100% now, and I don't think she ever will be. But she's still here, and she wouldn't be if it wasn't for that. The thing is, it's always been me and my mum. It's always just been me and my mum. So when I thought I was going to lose her, it was like one of the hardest things ever. So I think they're extremely brave. I know that I would be absolutely scared, and I get that they are probably scared, but it is doing some good, and they are helping people. And I think I can imagine it can be hard some days. It's not like because of it being hard because of the virus, but obviously what they have to see and what they have to witness. But it can come to some good, like especially with my mum, it definitely came to some good.
2.5 years now since I was in the intensive care, and that was due to sepsis pneumonia. As I've said on a number of occasions when we've attended post hospital sessions and what have you, my opinion of the intensive care unit could not be higher. Both what they did for me, obviously I wouldn't be speaking to you now if it wasn't for those people. It's just, I cannot envisage what, everybody must have been through since the beginning of the year. That alone, I mean, the emotional strain, the physical strain, and then to have a bit of a draw breath, well, I suppose as far as we're concerned, but it still continued for all the people in the hospital, and then to have the whole thing start off again. I mean, your commitment, your professionalism, your caring is second to none, in my opinion. And when I think every little thing that you're doing when you're on duty is keeping one of us alive. The smallest little thing. I mean, without a doubt, the ICU and everybody involved. I mean, you are the heroes. You're the heroes of the country.
So what you're doing is amazing, because not only are you saving the lives of the people that are in there, but you're putting yourselves at risk. I mean, when Declan was in hospital with the pneumonia, there was no danger that the staff were going to catch it from him, and it seems unbelievable to me that medical staff are putting themselves at risk of catching this disease in order to help others. So, I mean, they are literally angels and the heroes of our age.
The intensive care unit in Southampton Hospital is the best in the country by a country mile.
Yeah.
And you should be so, so proud of that, because that reputation is not easily gained. But my God, every part of it comes down to the efforts and the attitude that all of you people show every day of the week. And for that, we cannot thank you enough from my experience, but also I know from what's been going on over the last 10 months, we would be in a much worse state.
Thank you.
Hi, my name is Laszlo. I'm one of the fellow colleagues in UHS because I work as a staff nurse in emergency department. I got sick with COVID-19 back in April. Actually, it was April the 15th when I was calling my nurse in charge to request to go into self-isolation. And it was a period of time when I was hoping that I will get through this disease very easily, simply because I'm relatively young, healthy, without any pre-existing health conditions. Unfortunately, in a week time, it was obvious that my condition is not improving, it's getting worse and worse. So it was April the 23rd when the ambulance took me into hospital, initially to my own workplace, where my own colleagues were looking after me in emergency department. But the very same day, I have been transferred to ICU. I think I can speak probably for many people who were walking in the same shoes as me, that your work is very much appreciated. You are doing an excellent job. Nothing that you do for your patients gets unnoticed. I think that even the smallest things that you do will be remembered. And whenever I think of this, it comes back to my mind a quote, which is one of my favorites, which says that people might forget what you said, people might forget what you did, but they will never forget how you made them feel. And I think one of the things that I will probably always remember, even if I'm gonna forget the faces, even if I'm gonna forget the names, even if I'm gonna forget specific details of my stay in ICU, will be how you made me feel secure, how you made me feel safe, how you made me feel listened, how you made me feel at the center of your care. Thank you.